I had a very interesting conversation with the patient today about melatonin. She doesn't have great sleep at the moment and often lies there for hours and then wakes up and tosses and turns. And good quality sleep is just so important. And if there's a lot of stress around, sleep is often the first thing that goes. So some of the things I recommend for sleep is using ashwagandha, which helps regulate your cortisol at night. Most people do wake up between 3 and 4 a.m., but the difference is a lot of people can just go back to sleep. Whereas if your cortisol is high, or you get a surge of cortisol and your mind starts spinning and you're thinking about all the things you have to do and all the things you haven't done and worrying about what lies ahead in the morning, this obviously isn't really going to help you go into a relaxed state. I personally take ashwagandha at night, and what I find, and many of my patients find, is that it helps create just like less stress in the body. So I often wake up, I can turn over and go straight back to sleep, which is great. Magnesium glycinate is also particularly useful for sleep, and around 250 milligrams a night can be quite helpful. Other sleep supplements like L-theanine can really help, and this would be something between 100 milligrams and 200 milligrams, and it's an amino acid and it's very calming. Tim Ferriss has been talking about it for years. We couldn't really get it in the UK like maybe 5 years ago, but it's quite widely available now by lots of good brands. In terms of melatonin, to make melatonin, we need to be in a completely dark room between 10 p.m. and 2 a.m. So most of us aren't even getting enough melatonin because they're not in bed at 10 p.m. or in a dark room. And the light from the phone affects your melatonin production as well. So taking 5-HTP can actually help to convert into melatonin as a slow release. But actually, a lot of people can take melatonin. I obviously talk to patients about sleep hygiene, having a wind down routine, having a dark room, not being on screens, not watching your iPad or your phone close to your face as you're trying to fall asleep. But for some people who are struggling with sleep, actually taking melatonin can be very helpful. In the UK, it's unlicensed and it needs prescribing. It's something I do for some of my patients who need it because the quality of your sleep is so important. If you're not getting good quality sleep, it's affecting your cancer risk, it's affecting your heart health, it's affecting your brain health. So melatonin is actually really important if you're not making enough to get good quality sleep, not just so you sleep well and you feel energized and well rested, but also so you can then go on and reduce your things like cancer risks and health risks for the future. So I hope that's helpful and giving you a bit more information on melatonin. I will add a caveat. Some people get weird dreams on melatonin and some people feel a bit hungover if they take too much melatonin. So for them, I would advise precursors, but I just think it's really important for people to have options.